Introducing NanoHive Medical's innovative HIVE Standalone Cervical System with soft titanium technology. The HIVE Standalone Cervical System with a biomimetic soft titanium lattice incorporates a patented rhombic dodecahedron structure, similar to the base structure for cancellous bone. The resulting structure incorporates patented independent end plates, with minimal titanium struts connecting the end plates to shield the internal bone graft from stress. Instead, new bone is loaded and strengthened throughout the lattice. HIVE implants incorporate an engineered subtractive surface treatment, which is applied throughout the titanium implants to support osteoblast adhesion and optimize the environment for bony on-growth and ingrowth. The anterior plate can be attached to the interbody cage either before or after insertion and can be adjusted to allow the cage to be placed further into the disc space. Streamlined instrumentation, including various angled instruments, accommodate a variety of anatomical conditions and approaches. The zero-profile configuration is designed to minimize contact with nearby vessels and nerves. Aggressive, self-drilling, self-tapping screws are designed to minimize steps, and a simple one-step locking plate allows for visual and manual confirmation. The low-density titanium structure improves radiolucency and reduces scatter on CT and MRI scans. Deliver a better fusion solution with the HIVE Standalone Cervical System.